Welcome. My name is Gena Timberman, and you are listening to Timber People, a podcast about people who, like timber, are strong, build and create, who gather us together like fuel that feeds fire. People who support structures of our community that uplift and protect. Halito, welcome to Timber People. I'm really excited today to dive in and visit with my friend and associate, Carrie O'Rourke. Welcome.
Thank you so much for having me. I'm excited to be here in Oklahoma City.
Oh, I'm excited that you're here in Oklahoma City. I know that we have a lot of good work ahead of us and meeting with tribal leaders today and beyond about a very special program. And Carrie O'Rourke is the General Manager, Business Development for OnMed. And we're going to talk about what OnMed provides in their care stations and commitment to the rural areas throughout the United States and across Indian country. And before we dive in about the company and the good work that you accomplish, I'd like the listener to know a little bit about you.
Oh, okay, great, wonderful. Well, so I'm based right now out of Florida, but my dad was in the Air Force, and so I was actually born in North Dakota in Grand Forks, up by the Canadian border. And we moved about every 2 years throughout growing up. So I think I went to about 10 or 12 different schools. And so it was really I loved that. I loved being able to meet people from across the country. It gives you just a really different perspective, especially being a military brat. I know that we have a lot of veterans and active military across Indian country. And so to be able to share that commitment to this country, it's really special. It's really special. And so I think that it kind of forms in you this desire to want to give back, to want to really help support, this country and to make it better and to, help remove barriers for communities. And so I think that's really kind of helped form me and kind of who I am and the different jobs that I've had and the different focuses that I've had. And, at OnMed, we are very mission driven, and our focus really is about closing healthcare access gaps and removing the barriers to care. And so it's a personal mission, and to be able to do that professionally, it's really special.
It is. Access to care is so important, and also the opportunities to really employ innovative technologies in today's world. I have been so impressed to really learn about, I'm still learning so much about the OnMed care stations. And these care stations are so cool. They're like 11 by 9, maybe 6 foot deep.
Yep.
Anywhere that there's power or satellite, they can be plugged in. And, as we know in Oklahoma and throughout Indian country, that there are major barriers to care in the rural areas.
Absolutely. Absolutely. It's at a crisis point, and it's unfortunate that healthcare is really a privilege now in this country. We've got millions and millions of Americans that don't have access to care. And we're really excited with this technology. It is very futuristic. People are like, oh my gosh, this is like Star Trek.
Right.
We even have like a thermal scan where we can test any inflammation in the sinus cavity just through the thermal scan. But, we're leveraging the most cutting edge technology into this care station. We have a high def camera. We have an otoscope, that thermal scan, your traditional blood pressure cuff, weight and scale, but we still are human led. And I think that element is really important. Don't think Americans want an AI to kind of assess them and to have it so impersonal. I think there's a really, healthcare is so personal. It is so precious that having a clinician there take that time and listen and get to know you. And because of our model, we have a compassionate care model. We spend our clinicians at least 20 minutes with the patients. We really want to build that trust, get to know them, and make sure that we're addressing the medical need that's presenting, but also other issues that social determinants that impact someone's health and wellness if there's food insecurity, housing insecurity. We want to make sure that we have all of those resources built in. So it's a really beautiful model. It's not just traditional telehealth. It's telehealth on steroids, I've heard folks say, but it also is a very compassionate and high touch approach.
I really love to hear the testimonials of these communities that already, what are there, about 30 across the country now?
Correct.
Including Puerto Rico, perhaps.
Yep.
And I know that so far to date, as of this recording, there's one tribe that is already engaging in the opportunity to have the care stations in their community. And I'm excited for Oklahoma tribes and tribes throughout the country to learn more about what this could mean. And just looking at the videos, you can see the opportunity to incorporate community identity, tribal identity, language, and wrapping the care stations that really speak to that tribe's identity and the community presence. I always think about the opportunities and experiences that we have in the rural communities and tribal areas where we have our community centers. We have our cultural centers and museums. I really love the idea of being able to for a family to go visit their museum or cultural center, and their elder grandmother can also go seek the care that she needs, and as well as other family members. And so that accessibility that can be positioned in the cultural and the social experiences throughout Indian country, I think is really special.
I absolutely agree. We are bottom up. So this is a tribal-led initiative. Like you said, the care station would be wrapped in the tribal brand or logo, or if they have any kind of any way that they want to showcase the care station to show that it's really owned and the tribe is really driving all the decision making. So that's just from the visual standpoint. It has that kind of emotional connection, and really the care stations are an extension of the local tribal health clinic. So if there are workforce issues, we can bring our clinicians, but our clinicians are all trained in trauma-informed care, how we greet the patient, the questions that we ask. Everything is customizable, and we make sure that the clinicians really understand where the care stations are placed, if they're going to be answering calls there, what the community demographics are like, what are some of the challenges and the barriers, and then again, what are the other resources that we can refer out to help really support that patient that's coming in, support them holistically. But if a tribal clinic wants to use their clinicians, again, this is their care station. It's an extension of their office, of their footprint, and so they can see patients as well. So it really is a way to expand their reach throughout the tribe. So it's about meeting patients where they're at. I think we really have a hospital-centric mindset in healthcare where the patients have to come and meet the doctors in the clinics where they're at. And we're trying to break that mold. And we want to meet the patients where they're at. We want to try to break down the travel barriers. We are able to use Starlink and satellite to be able to overcome some of those broadband connectivity issues. And so that's our focus. If there's weather, if it gets, there's challenging during the winter times, folks can't travel. Well, let's place these care stations in areas where they are able to get to. And so it's really changing that entire mindset where you're putting the patient first, putting their needs first, and really addressing what is the priority for this specific community that we're working in.
Absolutely. The statistics are startling. You think about more than 83 million Americans lack sufficient access to primary care. 80% of U.S. counties lack access to care. And 1 in 10 Americans live in a care desert. I mean, those are staggering numbers. Mm-hmm.
So, I think that we all probably know someone in our families that live in one of these areas.
Right.
So it's this is why what's happening at the federal level with the Rural Health Transformation Program, the federal government is recognizing that this needs to be addressed. And so what we're seeing is a $50 billion investment in rural health this year, which is absolutely fantastic. It is the single largest investment in a generation in rural health. And when you think about, rural communities, it's where our food comes from. It's where a lot of the folks that serve in our military come from. It's the backbone of this country. And so we really need to revitalize our rural parts of this country, and providing access to healthcare is paramount. And so this is an exciting time. CMS made all of the awards just before the holidays, the new year. And so the states now are reworking their applications. Initially, it was up to $2 million a year over a 5-year period, so potentially up to $1 billion that states could receive. Alaska received the most funding, over $240 million. Oklahoma has a solid amount of money as well. Their application was really strong. And so, we're hoping to see states move towards this procurement process in February and March and start to get some of these dollars and tools like OnMed care stations out into the field, so that we can start closing these care gaps and really start serving people across the country.
Absolutely. I'm excited. If the listener wanted to learn more about OnMed, can you please share the website?
Yes, it's www.onmed.com. If you have any questions there's an info email that you can go to. I get those emails, so I would love to correspond with you if you've got questions. If you want to bring a care station to your community and want to learn how you can do that, let me know. We're absolutely interested in partnering with health clinics, federally qualified health centers, rural hospitals. Again, our goal is to be an extender of, and to really close those access gaps by placing our care stations. It's about 8x10 size of a Mini Cooper, right. So it's not a big footprint. It's a 3-prong plug that we power into, and again, we're able to leverage satellite if broadband is an issue in the community. But really, it's a plug and play where you can be in the ground in 45 days and seeing patients. So it's I think of all of the opportunities that are out there that can have an immediate impact in serving and changing people's lives. It's OnMed right now. So we're really thrilled to be part of this movement across the country.
Right. When I think about, this model is really exciting, because the amount of funding that it would take to create the whole bricks and mortar for a clinic anywhere, this really provides a really exciting solution to those challenges and obstacles. And, just reading and learning about it with the hybrid care approach, from, eye, nose, and throat to skin check, weight, chest and lung exams, blood pressure, heart rate, congestion, temperature check, oxygen levels, the e-prescriptions and specialist referrals, as well as treatment plans. That's incredible. It's really incredible.
It is. There is nothing out in the market right now that is so comprehensive and fully integrated. And what's really exciting is that our goal, our roadmap for mid to end of next year is to bring in behavioral health. So right now we're able to do mental health screenings, and we can make those referrals out. But for a patient to be able to go in and choose a primary care visit or a mental health visit, I think is going to be a game changer. To be able to get that level of comprehensive care is going to be important. So we're excited to see that. And again, we're thinking, Q3, Q4 of next year, we'll be able to bring that into communities.
Right. The timing is great with the Rural Health Transformation Program funding out throughout the country. And so, Carrie O'Rourke, it's been great to have you on the show, and I'm excited to be working with you and sharing the information about the OnMed care stations.
Thank you so much. Thank you for having me. I appreciate it. I look forward to coming back when we have our first ribbon cutting in the state and have you there.
Absolutely. I'm excited. Yakoki. Yakoki, thank you for joining us. Timber People is brought to you by the Possibilities Podcast platform.